breaking occurs in the face of the potential loss of someone that a family loves very much, some precious person. And so it's going to be difficult, but it doesn't need to be as difficult as it sometimes is. And the way to make it less difficult, in my mind, is to have very open communication between the ICU team, all other caregivers involved in the patient's treatment, and the family. If a family feels that all appropriate treatment has been provided and that further application of ICU treatment or technology will not yield benefit for the patient, then the decision is clearer and there's less agony in making it. And the only way for a family to feel this way is if there's ongoing communication between the ICU team and the patient and the family.
There are many times in the care of patients where we as healthcare professionals reach a point where our technology is not helping them. And there are often questions about how we ought to proceed. Should we continue these therapies? And from a perspective of a family member, I think the question is, what is the goal? What are we trying to achieve? And if these technologies are only prolonging the dying process, then we're not obligated to continue those. And I think that for family members, it is important for them to realize that just because we've started a technology doesn't mean that we have to continue it if it's no longer benefiting the person.
In the setting of withdrawing life-saving treatments, it's very important that family members have good communication with the clinicians. It's very important that issues of symptom control be attended to. When we take away, for example, ventilators, we want to make sure that we give patients adequate medication so that they're not going to be short of breath. And it's very important that we communicate with family members about what's going to happen after that life-sustaining treatment is withdrawn. You know, how long patients may survive, what that dying process may look like, and what we're going to do to make sure that it's comfortable for the patients.
I think what is absolutely essential is that we communicate to the loved ones of this patient that withholding and withdrawing life support does not mean that we are withholding care. Every patient in an intensive care unit requires and needs and deserves aggressive care. The question is, what do we mean by aggressive care? It may be aggressive technological care at one point, and it may be aggressive comfort care along the way. So withholding and withdrawing life support does not mean we are abandoning the patient and not recognizing their needs as they are dying.
Many people have a limited view of what's possible at the end of life. So when we have really exhausted our technology in attempts to try to cure someone, to try to turn around their disease process, people perceive that there's nothing else that can be done. And in fact, there's a lot that can be done. And one of the areas where I think the public can really advocate successfully is in the area of pain and symptom management. We have a wonderful array of technologies and skills that can be brought to bear on treating a person's pain and symptoms. And often families aren't aware that they have that as an option to advocate for.
Many people are very concerned about what kind of care is going to be provided to them and to their loved ones at end of life. What is in the minds of a lot of people is that dying will be painful and lonely. I think what's important for many people to know is that we have many, many more interventions and a much greater knowledge of how to keep people comfortable. Dying does not have to be painful, both physically and psychologically, and we do have the knowledge and the skills as clinicians to promote comfortable dying for patients, and I think that's important for family members to know.
So why are we talking so much about end-of-life care? Why force ourselves to deal with these difficult, painful questions about death and dying? What is to be gained from all of this questioning and searching? The goal is so very simple: to provide a caring, compassionate environment in which every patient and their loved ones may go through the dying process.
Although there's a sense of loss at the end of life and grief about the loss, there are opportunities for a positive experience even at the end of life and even in the setting of an intensive care unit. If a death is occurring at a time when it is clear to everyone involved in the process that there is no benefit to giving any further treatment oriented toward life prolongation, then there is a sense of acceptance, a feeling that all appropriate care has been provided.